there is a natural decline in the fertility potential, in the number and the quality of eggs that we have inside our womb. So that's the reason in age group 35 and beyond, for any fertility procedure, the success rate much lower as compared to less than 35 years of age. Stress, lifestyle is one issue. The second major issue is delay in the time of conception, delay in planning a pregnancy. Not after 40. The risk of miscarriage is 1 in every 3 pregnancy.
Wow.
But had I frozen eggs at 30 years of age, my risk of miscarriage would have been 1 in 7. So
Wow. I'll introduce myself. My name is N. Jamir. Friends call me Jamie, to have this short interview on what infertility is, how it impacts our socioeconomic condition, and what advice a practicing doctor like you would give to people trying to conceive. So for our viewers' benefit, could you kindly introduce yourself?
So, hi, I am Dr. Prachi Benara. I'm working as a fertility specialist in Gurgaon. So, I've done my studies and training from India as well as UK. I have done my fellowship from University of South Wales, UK, and I've done an observer training in Oxford University.
So, what, according to you, is infertility?
So whenever a couple is trying to conceive and it's been more than a year of unprotected sexual intercourse and still the couple is not able to conceive a child, is infertility. According to WHO standards, the rate of infertility in any urban area is 1 in 4.
1 in 4?
Yeah. In rural area, it's somewhere around 1 to 5 or 1 in 6. So now we fertility specialists treat infertility like an epidemic. It's a fast growing, and there are so many people in country and abroad who do not have the intellect to understand that they are actually suffering from a problem. So most of us stay in our families. We even hesitate in talking to our parents, talking to our friends. And finally, after say 5 or 6 years, when we reach a fertility specialist, that naturally there is a natural decline in our fertility by then. So it is very important to educate the mass that help is available. And infertility doesn't mean a female problem or a male problem. So it's very, very important to come out of this social stigma and consult a fertility specialist.
Right. In your practice, do you see that different types of age group? Let's say because some doctors are saying 35 and below is 1 year, you treat them normally, and then you declare infertility. And for women above 35, you treat for 6 months. So do you see different types of fertility issues for these different age brackets?
Yeah. So as you mentioned, below 35 years, we take the time to be 1 year of natural trying. But as soon as the woman, basically the woman's age, as soon as the age of the woman reaches beyond 35 years, we are very aggressive and we say that that person should visit the fertility clinic within 6 months.
Right.
Because as we age, there is a natural decline in the fertility potential, in the number and the quality of eggs that we have inside our ovaries. So that's the reason in age group 35 and beyond, for any fertility procedure, the success rate much lower as compared to less than 35 years of age. And the main reason behind this is the declining reserve in terms of quality and quantity of eggs that we have inside our womb. The basic success rate of any fertility procedure is still very well appreciated. It's a decent number. If I have to quantify in terms of number, it is above 60-65%. But as soon as the woman's age reaches 35 and above, the success rate goes down below 50, 45, 40%.
So it keeps declining as the years progress for the woman.
And it is very important to understand that it's not only a pregnancy, but it is finally delivering a healthy child. So as we age, the risk of miscarriages, the risk of abnormalities in the child continuously increase.
Right. So it's not just a difficulty in getting pregnant, but yeah, miscarriage.
Sustaining a healthy pregnancy and finally delivering a healthy baby also becomes a challenge after 35 years.
Right, right. Ma'am, would you say that age in the male partner also matter?
It does. It does. So men thankfully are even able to father children at 60 years of age, they are provided they have a healthy lifestyle. If we compare this to present age men who are living in this environment which is full of pollution, who are dealing with soil pollution, water pollution, noise pollution, they have a hectic and a stressful lifestyle. Most of us succumb to alcohol and smoking, to our anxiety. All these factors add to their fertility potential as well. So, by what God has designed a male body, males are even able to father children at 60 years of age. But due to our lifestyle, more the years of exposure to such insults, the greater decline we see in the fertility potential of males as well. So, there is no natural decline,
Yeah.
but this is artificial or man made decline, which is happening in their fertility.
Right, right, right. And the same goes for women also, right? Even if age, we are going to leave aside age, unhealthy life choices affect fertility.
Absolutely. So most of us have a desk job. We are sitting at one position trying to work on our laptops.
Yes.
In between, we have a habit of snacking.
Yeah.
We eat all junk and frozen food. And in the end, the activity that we do in a day is less than 1,000 steps. So, this adds to obesity and thus interferes with our fertility. Then stress is a very major factor. So, one thing which we don't realize is because of our lifestyle, the intimacy between the two partners have also declined. So, whenever I ask the couple to try naturally, ma'am has suggested to have intercourse, that's why we are together. And that's also a task. And sometimes men suffer from erectile dysfunction, ejaculatory disorders. Women start facing the issue of vaginismus. Most of the couple come to us and say that they don't have that desire. It's like a mechanical process, a big danda on their head to try.
Yeah.
So it shouldn't be like that.
It's a compulsion.
So this what yeah, it's like a compulsion for them. It's not an act of joy. It's too frustrating for them to be together. So we have mechanized our daily routine in such a fashion that something which was so natural is now a burden for most of us. So that also adds to infertility issues.
It's kind of unthinkable to think of the sexual part as a mechanical thing for a lot of couples.
Absolutely. And sometimes, if we see women with multiple sexual partners and unprotected intercourse, then there are certain kinds of pelvic infections like chlamydia, gonorrhea, which can spoil or damage our tubes. So, this is not that common in India, but back in UK, this was one of the very major issue which we used to see of tubal blockage in female partners. In India, it is basically tuberculosis, but in Western countries, it is gonorrhea and chlamydia, which causes tubal blockage.
Would you say that you see a spike in young people with fertility issues these days?
Absolutely. So if I compare our parents with us, so when they were in the reproductive age group, they had this biological clock in them that by the time they reach 25, 30 years, they should have one or two child, family complete, and then they are concentrating on their professional life.
Yes.
Now, this is vice versa in our generation. We first focus on our studies, then our career, then we take time to find the right partner. And by the time we think of pregnancy, we are already 35 years. So, stress, lifestyle is one issue. The second major issue is delay in the time of conception, delay in planning a pregnancy, not understanding that biological clock is ticking and we will take much more effort to conceive a pregnancy at an elder age as compared to a younger age group.
Yeah, I think that's one information which we have to spread far and wide, that there is this thing called biological clock. Because a lot of women, even my friends and myself including, we are so much in pursuit of our careers that we forget about the biological clock and we put it in the second.
And it's a very personal choice. In case we want to delay our pregnancy, because our personal and professional commitments can be against it, then we should think of freezing our fertility potential by doing egg freezing or semen freezing.
Right.
So this is very important, that it's okay to delay pregnancy, but keep a backup in terms of cryopreservation, because at this point of time, the cryopreservation techniques are wonderful.
It correlates freezing of eggs and sperm. It correlates with the age on which the mama or the dad freeze their eggs and the.
Absolutely. If I am 30 and I decide to freeze my egg today, and today I'm 40, the age of my eggs will be 30 years.
That is wonderful.
Yeah, and so one thing which is very important to understand, that at the age of 40, the risk of miscarriage is 1 in every 3 pregnancy. Wow. But had I frozen eggs at 30 years of age, my risk of miscarriage would have been 1 in 7. So that holds true for me if I had frozen my eggs 10 years back. So it eases the chances of becoming pregnant, at the same time reduces the chances of miscarriage, reduces the chances of congenital anomalies in the baby. Cryopreservation technique is wonderful.
Yes, it is.
Initially, it was only for people who have cancer or any other problem which affects our ovaries. Books started, including it in their insurance pack. It has a boom. Almost 7 years back, Apple started giving this benefit to its employees. So since then, it is, something which is globally accepted.
It's wonderful, the leaps that we are making in technology.